Welcome to Forum for Health. I'm Dr. Ken Wool. Today I have the pleasure of talking with Dr. Clemmie Palmer. Dr. Palmer is a psychiatrist. Clemmie, welcome.
Nice to be here.
We're talking about ADHD today. What is that?
ADHD is a neuropsychiatric disorder characterized by many different titles in the past: membrane dysfunction, cerebral dysfunction, hyperkinetic syndrome, but it's really a constellation of several different symptoms.
This is something that, like you said, has been around a long time. Is it something that is more common in boys or girls?
Well, it's slightly more common in boys, probably 4 or 5 to 1.
One thing that I've always wondered is how you separate out, you know, boys are different from girls. When you're raising your kids, they're just into more things. How do you decide if it's just being a boy or if it's ADHD? What criteria do you use to really get into the diagnosis?
Right, to really diagnose ADHD, it needs to really happen in 2 different settings, at school or home, and not just one particular setting. We have a set of criteria in what we call the DSM-4 manual that we use to go for the objective findings of ADHD.
And are there different types?
There are 3 types: ADHD inattentive type, ADHD hyperactivity or impulsive type, and then there's a combined type.
And what is the prevalence of that disorder? Is it very common?
It's pretty common. It occurs in about 12% of boys and girls. We used to think it was about 5% around 1994, but we now know it's about 12%.
So you think it's more common, or you think it's just being recognized more?
Ooh, that's a good question. It's probably been around all the time. It was just under-recognized years ago.
Because I mean, when I was a kid, I don't think that diagnosis probably even existed in the manual, and now it's
right. And everybody had different code words for it back then, also, like minimum brain dysfunction or anything like that. So it was around, but it just wasn't specified out.
Then, in the DSM or the textbook, what are the diagnostic criteria?
One must have at least 6 symptoms. There's a lot of different symptoms for it. Inattentiveness, for example, not paying attention well, not doing activities that require sustained attention, preferring to do something that's pretty quick, hyperactive. Different symptoms, for example, blurting out answers in school. There's a lot of different symptoms like that. Losing material easily, very unorganized. It's rare for one person to have all the symptoms, but they do have a lot of the symptoms.
How does I guess a teacher or a parent, if they have a student that's a little bit disruptive, how do they decide, I mean, if they're going to call you or call a counselor or whatever to make that diagnosis? What tells them that they're crossing that line between, you know, being a kid or a little bit rambunctious kid and having ADHD? Right.
A lot of teachers now somehow got a lot of checklists that I didn't know about until I got on the internet and started searching for different checklists. And what I do now is give teachers those checklists. They'll just check off if the kid fidgets too much, not pay attention, they seem to zone off. Almost like a mild seizure sometimes, but they seem to zone off, but it's not a seizure, and they come right back in a few seconds, and they just keep up with that and sort of document it, and then talk to the parents for a referral to a psychologist or a psychiatrist or a pediatrician.
So assuming that someone encounters a child like that and they refer them to you or to a psychologist, how do you make the diagnosis? Are there tests, or you talk to them? How do you figure that out?
Right. It's a clinical diagnosis. At times I may get a test because they can help me when it's too confusing, but it's really a clinical diagnosis. We have to get a good history and weed out any kind of comorbid diagnosis that could be associated with it or confusing, because it can be very confusing with somebody with attention problems and say maybe a learning disorder, or attention problem and say behavior disorder. So I just weed it out. And really I'm trying to weed out oppositional behavior from just people that just can't pay attention. I just kind of go through. Do you listen to your mom? No. Do you listen to your dad? Yes. And that lets me know it's more oppositional instead of attention problems.
You mean more like what would be an example of a behavior problem in a kid versus attention deficit?
I say when a child chooses not to listen to a teacher but listen to his parents, or vice versa, or misbehaving, say in one setting and not more than 2 or 3 settings, just very selective about when the symptoms occur. That's not really ADHD. ADHD is not a willful disorder. It's not under their power. It just displays signs of hyperactivity and impulsivity no matter where they are. They can suppress it for a few minutes, but they can't suppress it for a whole day.
And are there rating scales or that you use?
Right. Rating scales are good really for me to monitor the progression of the disorder. Connors is a big one that a lot of teachers use. There's Copeland's, there's a lot of different rating scales that we use really for the monitor the progression of it. But I like to use it also to have objective data in the chart. The parents ask me, well, a year after I started on the medicine, why'd you do it? I can say that this is what you checked, this is what we did, it's all in the chart in black and white, and it's pretty objective.